morning, everybody. I'd like to welcome everybody to Sebastopol, and I really want to welcome our governor. Thank you very much for being here. We're a wonderful little town, and we have a wonderful facility here that our community is very proud of. I want to introduce you to somebody who is very important to the success of this project, our 5th District Supervisor, Linda Hopkins.
Thank you so much. And I really have a lot of people to thank today, and I want to recognize that we are never going to end homelessness as a state without a substantial investment of capital and also social capital in terms of collaboration. This project would not be possible without the leadership of Governor Gavin Newsom and the collaboration and partnership between the County of Sonoma and the City of Sebastopol. So I'm extremely grateful for everyone who showed up in support of this project, attended town hall meetings, and actually came out to say, you know what, we have to be part of the solution. Just want to let you all know that we have fewer than 8,000 residents in the City of Sebastopol, and so if a small city can step up and be part of the solution, any city in the state of California can be part of that solution. And without further ado, I would like to introduce my colleague, Supervisor James Gore.
It's a pleasure to host you here today because it's about results right now. This has been an issue that everyone's played whack-a-mole for about the last 20 or 30 years, and that has to stop, and it has to stop here, now, in our communities. We have never encountered such an issue as homelessness where everybody wants it fixed, but nobody wants to be inconvenienced by the solution. The solutions have to be embedded into your community. I want to give a quick shout out, round of applause, Michelle, Dima, the whole staff back here. We have had 3 different sites in Sonoma County over the past year, 2 home key sites, 1 alternate care site, non-congregate site, that they've been able to get up and moving within a week and get people into solutions now. In addition to being a county supervisor, I'm president of the California State Association of Counties. I'm also daddy to Opal, who says she's going to take over my job here. And, you know, what we have advocated for, partnered with the governor and others on, is more resources but more accountability. More resources, more accountability. No programs, no dollars without putting placements, without getting people into safe places. That is what we've seen from this investment. That's what we see with the accountability measures that are embedded into this, that we can take the money, but we have to be able to show that we are showing results, not only on our numbers, but then to our community on the streets. With that being said, I want to invite Assemblymember Mark Levine, huge champion for us here in the North Bay. And Opal, thanks for joining me. Bye, guys.
Thank you, Opal, and thank you, Supervisor Gore. We've got just an amazing team that really cares about housing everyone in this community, really cares about everyone throughout this pandemic, from Director Rivera, Mayor Glass, Supervisors Gore and Hopkins, Senator McGuire, Secretary Castro Ramirez, and Governor Newsom especially. Thank you so much for all the work that we've done over the past 18 months of this pandemic to care for everyone. It's important to note that we're here in Sebastopol, and we are in the middle of this pandemic still. I remember when we had a number of vaccination-related bills come through the Assembly and the Senate, people would come to me and say, we know you've got some people in your district, some constituents who are hesitant about vaccines. And we understand if you can't vote for vaccine-related bills when we were trying to make sure that every child in school is vaccinated. I remember hearing that, and I remember thinking, no, wait a second. I'm a father, I've got 2 kids, I care about their health and safety, I care about the health of everyone else in school, and I know what the science says. The science says it's safe, and it's okay, and it's good and important to vaccinate your children. So here we are, and we're at this point in the pandemic, and we're seeing some real data come in. People are getting sick again in higher numbers of COVID-19, and they are mostly the unvaccinated, and they are putting the vaccinated at risk. So I want to make sure it's very clear to anyone who's listening to this, who's looking at the data pour in, it's not too late to get vaccinated. I was just in front of a Walgreens Yesterday, with my kids, I saw a sign on the door, free vaccines for COVID. Schedule an appointment. So schedule an appointment. They're available to you. Please go and get vaccinated. Please protect your health and the health of everyone in our community. So let's come back to where we are today at the Sebastopol Inn. And prior to the pandemic really gaining a lot of steam here in California, I recall quite vividly Governor Newsom giving a State of the State address with a singular focus on homelessness. And I remember being overwhelmed by how powerful that was for a State of the State address to address this issue that I remember as a city council member we struggled with, that we continue to struggle with. And I was so grateful for that focus. And I don't know, Governor Newsom, if you recall, I went over to the governor's mansion afterwards, and I went and made a beeline to him, and I said, thank you. Thank you for putting a focus on this. And as the pandemic occurred, that thought could have been lost by the wayside. But in fact, his focus on finding a home for everyone was ever more important. Could never be more important, because we need to make sure that we protected the health of everyone, regardless of whether they had a home. But we also needed to limit spread. And we know that if we had everyone sheltered, that could also limit spread. So Project Home Key really came and saved the day for so many Californians. And we poured a lot of effort into this last year here in Sonoma County, where there are 2,745 homeless people at the last count. We were able to get 3 Project Home Key sites up and going, including this one. And this is just a marvelous, wonderful partnership, an example of what more we can do. And of course, now that we've got AB 140 to continue this important work on homelessness today, again, I say thank you to the governor, also to my colleague in the legislature, Senator McGuire, for working to make sure that we can continue to pour our resources behind this. Now I'd like to introduce my friend, Senator Mike McGuire.
Good morning. Thank you so much, Assemblymember Levine, and grateful to work with you. To the Board of Supervisors Chair Linda Hopkins, Supervisor Gore, the amazing Mayor of Sebastopol, Una Glass. Mr. Governor, thank you for being here today. I also want to say thank you to Mr. Elliott for all of his work as well on this critical project. I think that we can all agree that this homelessness crisis has hit working families and seniors in big cities in our state's most rural counties. High housing prices and especially rents, along with the COVID-induced recession, has impacted the most vulnerable here in the Golden State. Behind the beauty of the North Coast, where we are today, are some ugly statistics. Just north of us, Mendocino County has the 3rd highest homeless population in California and the 12th highest in America per capita. Humboldt County, for example, has the highest per capita homeless population in the state, 3rd highest in the nation. The North Coast has some of the highest opioid addiction rates in the West, along with some of the highest rates of child abuse and endangerment, also called adverse childhood experiences. And these issues, they're all related. The homelessness crisis has hit us so incredibly hard in rural California. And if we're being candid, Sacramento hasn't always been focused on rural California. Now that has changed with Governor Gavin Newsom. Governor Newsom, working in partnership with the legislature, the Board of Supervisors, and city councils across this state, the governor has made it his mission. He's made it his mission to invest homelessness funding where we need it most. His approach is data-driven. His approach is intentional. Invest where the need is greatest. No matter if it's Sebastopol, Skid Row in Los Angeles, or Crescent City. Governor Newsom is responding with funding for permanent housing wrapped with addiction services and mental health counseling. And it's about time. $15 billion focus on homelessness and workforce housing. It's unprecedented. It's historic. But most importantly, because of the governor's focus, it's going to change generations of lives across California. We are incredibly grateful that the governor is here today. We want to say thank you. Thank you for your investment in the most vulnerable in California. Without further ado, I'd like to welcome Governor Newsom to the podium.
Thank you. Thank you, Senator, very much for that kind introduction, and Assembly Member and Mayor, to our supervisors that are here, to Douglas and Claire, who you'll see in a moment, who are testament that we can end homelessness here in the state of California. We don't think that, we know that. This project is proof point. The challenge, of course, the state faces is scale, and that's what we're here to address. Today, I'll be signing a bill, the largest homeless package in the history of the state of California. Let me be more specific. The senator made a comment a moment ago that I think is important to underscore. The state of California, with all due respect, has been nowhere to be found on the issue of homelessness for far too long. There's been no intentionality, his word. There's been no focus on helping support cities and counties. Been left to cities and counties themselves to address the issue of poverty in all its forms and manifestations, particularly the issue of homelessness. That has changed over the course of the last number of years. In the last few years of the Brown administration, there was an effort to renew partnerships, to no longer point fingers, find scapegoats, but to find solutions, to build collaborations, to start to develop networks to address the issues of homelessness and particularly address the root causes of homelessness. We took that baton 2 years ago, and we put forth an historic investment in homelessness at roughly $500 million. We followed that up a year or so ago with the largest investment in the history of the state of California, $950 million, building on those partnerships that we developed with cities and counties and what we refer to as COCs, these continuum of cares all throughout the state of California. It was a renewed effort to take responsibility, to take accountability, and to recognize the urgency of the crisis in the state of California. Today, we're not just doubling down on that. Today, we're taking it to a whole different level. When we talk about investments and we put it in terms of historical investments, we need to go back to 1967 when this state began the systemic dismantling of behavioral health housing here in the state of California. In that infamous first budget, Ronald Reagan's infamous first budget as governor of California, where faced with a budget crisis, we began to systematically destroy the network of supports all across the state of California, particularly for people that were experiencing crisis issues related to bipolar disorder, schizophrenia, paranoia, people that were self-medicating with drug and alcohol addictions. Since 1967, and for decades since, the state of California, and for that matter, this country, has pulled back on those supports. The investments we're making here today are the most historic, the largest investments in mental health housing in California history. $3 billion will be invested to help with board and care, for conservatorships, for Laura's Law placements, to provide opportunities for people in crisis. We are proud of that. It's part of a $12 billion homeless package that I will sign here today. $12 billion investment. I'll remind you, the largest investment in history was $950 million. This is a $12 billion package. And as President Gore said, and this is profoundly important, it comes with strings attached. More transparency and more accountability. I'll never forget when Supervisor Gore called me a number of months ago, a local elected official who just took the reins as president of CSAC. It is basically a coalition of county leaders, and said, hold us accountable. Don't just give us more money. More is not better. Better is better. We need to be accountable for results. And we took that seriously, and we worked collaboratively with the senator and the assembly member. We worked with the budget teams. We worked with our leadership, and we actually put forth the first accountability requirements in state's history as well. I won't go into the details of that, but there's 6 metrics that counties have to meet. And if you meet them, we're actually attaching bonuses, 18% bonus opportunity for actually delivering on the plan. No plan, no money. No plan, no money. We're providing $2 billion of discretionary support as part of this accountability package for rapid rehousing, for rental subsidies, to provide hotel motel conversions like you see here, and to provide other supports that are critical for getting people back on their feet. And so prevention dollars, intervention dollars, and long-term supportive housing funds are now being set aside, $2 billion over the next 2 years with, again, new accountability provisions. Largest single investment in providing support for the most vulnerable in American history. And I'm incredibly proud to be able to sign it here today at a location that proves the paradigm. Madam Mayor, thank you. To the supervisors, thank you for not only identifying a problem, but identifying a solution by identifying one of 2 hotels in this city. A hotel, by the way, that generates about $85,000 a year just in hotel tax. Converting that to a facility to help the most vulnerable residents took courage and took guts. It took political leadership. And so I want to thank you, Madam Mayor, for your leadership, and the supervisors for getting things done. Not everybody was thrilled with this project, but this project's changing lives. And by the way, this project, they were able to get down into escrow and get people into housing in less than 5.5 months. Now we're talking. Not 5.5 years. What's so extraordinary about what we're doing differently, because people have the right to ask, what are you doing differently? Because we want to see results in real time. This project was one of those examples. 6,000 housing units we were able to get into escrow and convert within 6 months under Project Homekey. It's now a national model. The Biden administration put $5 billion up to replicate the success of California's efforts. Project Roomkey, which we initiated early last year, 42,000 human beings we were able to get off the streets and sidewalks and out of shelters, out of harm's way during the COVID crisis, and into housing. We have over 10,000 people currently being supported under Project Homekey, and $150 million in this budget to continue that project, even if and after. And I say if because we're going to continue to work with the federal government, and after, if they no longer support this federal program, we will pick up the slack substantially, not completely, but substantially as a state. So mental health, interventions, proven, successful, time value of money, CEQA and land use, zoning, reforms, and accountability measurements and metrics with bonuses and performance expectations attached. This is a new day in terms of our strategies. Final words on homelessness. You need 3 things to actually make an impact on homelessness. You need to have a plan. The state didn't have one for decades. You need to have the resources. Even if they had a plan, they didn't have the money. And 3, you got to have political will. All those 3 things are in evidence in the state of California today. Our partners all across the state, the big 13 mayors, the county supervisors, local officials recognizing the crisis and recognizing our individual and collective responsibility to do more and do better. So it's in that spirit that I'm here. 12 billion reasons why I'm looking forward to take this pen and putting it to this piece of paper. I want to thank the senator and thank the assembly member for being champions on getting this money down to the proverbial desk. I want to ask Douglas and Claire to come on up, but they already got cued, and ask the rest of the team to come on behind me as well, including Jason Elliott, who's worked so hard to make all this happen. And we will do I like signing bills standing up. It's a little more interesting. By the way, just on a technical point so people understand, this is one of a number of what we call trailer bills in the budget that the Assembly member in the Senate sent to me last Thursday. We have 12 days to sign these bills. This is the first of the package of bills. The issue of homelessness, top of mind, real accountability, real responsibility, and yes, you expect, we demand real results, and that's what this signature intends to do. Thank you all very, very much. All right. So, that's how quickly you can invest $12 billion. Now we're here to answer any questions you may have.
Governor. How's it going? Thanks for coming down. So this $12 billion comes as a result of a one-time surplus. So going forward, how do we ensure, cities and counties will continue to be supported and funded with any new efforts that come as a result of this money?
Well, we're committed to the long run. We committed last year during the midst of a great recession, a $54.3 billion budget shortfall, yet we invested more, not less, in homelessness. And we continue to make historic investments as well in housing. So as long as I'm governor of California, that's not going to be an issue. I'm committed, not interested, to addressing the issue of homelessness. I appreciate Assemblymember Levine marking the reference and reflection on a state of the state that was devoted completely to this topic. And despite the fact that that was held just a few weeks prior to the beginning of the pandemic last year, our resolve remains steadfast and our commitment is demonstrable. These are multi-year commitments, not just one-off, and we expect and intend to bridge these commitments with additional federal supports, and our advocacy at the federal level is second to none. And we continue to look forward to building partnerships and collaborations, not only with governmental agencies, but also with community-based organizations, neighborhood leaders up and down the state as well. It's a new day, and we're here for the long haul.
Just one quick follow-up, a more immediate concern. Here in Sonoma, we're having a serious outbreak, COVID outbreak, at our largest homeless shelter over in Santa Rosa. I think that underscores we're still, in the throes of this pandemic in many ways. So I want to know, have there been outbreaks at shelters across the state that you're aware of? And what is the state doing in the immediate term to make sure our homeless population remains protected, especially as a lot of the temporary room key hotels, that program is kind of winding down?
No, and I appreciate the way you contextualized the question as well and framed it. Room key was initiated to address precisely the issue that flared up a few weeks ago here, or just recently rather, at a local shelter, and that was to protect people in these congregate settings. Room key became a national model. As I noted, 42,000 people have been supported through the Room key effort, and that's to get people out of those shelters and into hotel rooms like those you see around us. We currently have exactly 10,445 rooms as part of that portfolio, supporting opportunities for north of 10,000 people to get out of the congregate environment. That said, it's due to expire at the end of September. We're working with FEMA to try to get it extended. We have formally asked FEMA to extend that program and the federal supports for that program through June of next year. In the absence of that, in an effort to supplement those efforts, the bill I just signed, as I noted, included $150 million to support efforts in communities like this to get people out of those facilities, particularly to address the concerns, the growing now concerns, as it relates to an increase in transmission, particularly of the Delta variant. And so we'll continue to build on the success of the room key model, continue to procure more home key assets so we can get more people off the streets permanently, and continue to maintain our vigilance as it relates to local county efforts to address and initiate strategies to mitigate spread and to make sure masking requirements are being enforced, as well as distancing requirements in shelters. But the best way to address the issue is to do exactly what Assemblymember Levine said, and that's to get the unvaccinated vaccinated, so we mitigate not only the spread, but we mitigate the impact of those that contract this disease.
Morning, Governor. Wayne Friedman with ABC 7. Two questions for you. One related to fires, one related to this. Which do you want to do first?
I love it, like a game show.
Yeah.
What's behind door number 3?
Okay, 3, and we'll give you 1.
Okay.
There's a report this morning that PG&E equipment may have contributed to the Dixie fire. Have you heard about that? And if so, what's your comment or thought on that?
Same thing. I mean, these things all deserve an investigation, and I'm not going to jump to any conclusions. Those investigations are well known to people, particularly here in the North Bay, as relates to PG&E and their culpability to wildfires. We're dealing now, as you know, with the Dixie up in Plumas, Butte County, another large wildfire up in Alpine. We've got 7 major wildfires / complexes, 5,600 firefighters working those lines. I want to underscore where we are year to date in the state of California. A lot has been written about and talked about the number of wildfires and the acres burned year to date compared to historic amount of fires and acres burned last year. Let's put this in very sober perspective. Today we have over 200,000 acres that have burned in the state of California. Last year, at this time, 39,000 acres, five-fold the number of acres that burned compared to the historic wildfires of 2020. When you even look at a 5-year average, that number is notably higher as well, 3 times higher than the 5-year average. So we maintain our vigilance. We have an historic wildfire budget, which I've highlighted on multiple occasions. We'll continue to do so, some $2.2 billion of investments in an all-hazards approach to emergencies across the spectrum of emergencies, not just wildfires, but supporting resilience for all hazards, meaning wildfires as well as drought emergencies, as well as seismic events and the like. We continue to do more in terms of supporting mutual aid, continue to do more to demand from PG&E and other investor-owned utilities, real accountability and results as it relates to undergrounding of wires, as it relates to investment in their wildfire suppression strategies like early camera detection technology, the ability to make sure that they're doing the forest management and the vegetation management, which are foundational to wildfire prevention. So as it relates to any active investigation, it's just that. And when that investigation is concluded by CAL FIRE, we'll make some comments.
Okay. Second question would be this: $12 billion. How do you keep California from becoming a magnet for people who have issues in other states and coming here to take advantage of what California is spending? It's been a problem in the past.
Yeah, look, at the end of the day, we have a crisis. 150, 180,000 people, depending on how you make an assessment determination, out in the streets and sidewalks, the richest and the poorest state in America. We have responsibility and accountability as a nation state in terms of size, scope, size of 21 states' populations combined to address this issue, this crisis in the state of California. And we can abandon that, and we can throw up our hands, point fingers, talk about the good old days when HUD and HUD meant something, housing and urban development, before HUD got out of the housing business in the late 60s, 70s, and 80s. But at the end of the day, we got to take accountability, responsibility to do more and do better, and that's what this budget intends to do. It's about results. It's about getting people off the streets out of incidents of crises and meeting people where they are, and to the extent that people want to come here for new beginnings at all income levels, that's part of the California dream. And we have a responsibility to accommodate and enliven and inspire. And California's dream is still alive and well. $80 billion budget surplus. You've seen the jobs numbers last 5 months. We've averaged over 100,000 jobs every month. Highest job numbers in America. This state is roaring back, and I'm proud of people from around the world looking to California again for opportunity. And again, that should not just be for certain people. All people, I think, should aspire to that California dream, regardless of their income level and regardless of their lot in life.
Governor, would you care to elaborate on how the Reagan cuts have cost this state money?
Look, I just read, I may have reread it, though I have vague recollection of the first, though I saw my notes in the book. I don't recall when I was reading Lou Cannon's book about Ronald Reagan's first budget, the infamous budget in 1967, where Reagan himself at least laid claim to some regret of the nature of the cuts that he directed and his team directed to the behavioral health system in the state of California. It's indelible in the consciousness of not only Californians, but for that matter, the impact those decisions had around the rest of this country. Of course, Reagan himself has a lot of history in this space, not only as it relates to the early efforts in the dismantling of the network of supports on behavioral health as governor, but the supply side economics that he promoted as president. And in many ways, shapes, or forms, we have a responsibility to make up for that. And again, I'm not just pointing fingers here, but I am making a historical frame. This is the largest investment since that great dismantling. This is the most historic commitment to right the wrongs of the past and address that fundamental issue.
Governor Jody Hernandez with NBC Bay Area. Good to see you. Back to vaccinations.
Yes.
The Delta variant is soaring. It's very troubling. Yet our vaccination rates among the homeless remain really low. Some communities, 75% of the general population is vaccinated. Well, only 30% of the unsheltered are. What can be done? What needs to be done to change that, to reach these folks, to get them vaccinated?
Yeah, that's a good question. And let me highlight a few things. We've administered over 44,120,000 doses of vaccine in the state of California, 17 million more than the next largest number of vaccines that have been distributed by any other state. We have 76.5% of all 18-year-olds that have received at least one dose, 76%, which is impressive. But as you note, there's subsets of the population that we have not been able to achieve similar results. One of them is the unvaccinated population, homeless, people on the streets, congregate facilities, people living in their cars, people all throughout the state, including rural communities, but also people living in urban environments that have, well, frankly, been misled by misinformation campaigns that are literally killing people, by networks that profit off the misinformation, that literally are aiding and abetting in the deaths of thousands of Americans because of the misinformation. And so we've got to counter the misinformation. We have to meet people where they are. So your specific question begs a specific response. 480. That's the number of community-based partnerships that the state has formed. We've extended the contracts on the 480 partnerships. We're moving from stationary sites to mobile sites. That's specific to addressing populations that have been hard to reach. We had a setback, to be candid. J&J offered tremendous opportunity, particularly for the population you just cited. Homeless population, more challenging from a logistics perspective, but we are still working through that. And we're doing more mobile sites, more pop-up sites, and we are building more partnerships with these community-based organizations to target those vulnerable populations. And so that's the specific strategy. Broadly, we're doing more. Recently, it didn't get a lot of attention, $40 million of grants, small provider grants, to get community clinics, to get trusted doctors representing communities like Sebastopol, to open up clinics in their offices. And so we really want to meet people where they are, but also where they are with their most trusted messenger, which is their personal doctor, which is a family member. And that continues to be our efforts, strategic, focused, targeted efforts. I know it's rote and cliche to say we're doubling down on it. We're not just doubling down, we're doing substantially more than that with our grant programs, CBO partnerships, mobile vaccination efforts, and a broad communications campaign that is as culturally competent as any in the country. So those are some of the efforts.
Also curious about your thoughts on masking guidelines. Los Angeles County now mandating masks indoors. Do you see this being a possibility for the rest of the state?
I mean, I see counties all up and down the state, including up here, that are recommending mask wearing indoors. Not physical distancing. We want to get our kids back safely in school for in-person instruction. It was interesting today, the American Pediatric Association came out, basically aligned with California's mask mandates for returning our kids safely back in person to school. We are committed to getting that done, committed not to imposing new restrictions, but we are also committed to addressing this latest increase in the number of new cases here in the state of California. Very mindful of the transmissible nature of this Delta variant, very mindful of its impacts across the spectrum. And as a consequence, you're seeing not just LA County, as I noted, but Bay Area counties following with some form of requirements or recommendations. This is inevitable if this continues. And that's why it's so fundamental. If we want to end this pandemic once and for all, if we want to turn the page, we can get it done in a matter of weeks, not months. It's as simple as this. If you're not vaccinated, get vaccinated. If you want this disease to be in the rearview mirror, period, full stop, and you're exhausted by this, in the fits and starts of the CDC, local versus state and regional mandates, guidelines, recommendations, then get vaccinated. It is, I know, again, rote and cliched to say this because it's repeated by everyone, but it's repeated for a reason. It's a fact. This is a pandemic overwhelmingly and disproportionately of those that have not been vaccinated. If we want to turn the page on this pandemic, if you haven't been vaccinated, get vaccinated, get the second shot, and in 2 weeks, we can turn this thing around in the United States of America. We have the one thing the rest of the world is desperate for, and that's abundance of free, available, safe vaccines that can literally save your lives. I'll end on this, ask every one of those patients that are in the ICU today across this country what their number one regret is. They didn't get vaccinated. So we have the opportunity to turn this around and not have to deal with these recommendations, these mandates across the spectrum. And that opportunity resides in each and every one of us to make the individual decision that will change the course of history of this pandemic and this disease once and for all. Please get vaccinated. With that, I want to just thank everybody for your patience, for wearing sunblock, to the two of you that did, and to all the residents at the Sebastopol Inn for being part of the solution. We're grateful. Thank you all.